Prior to performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can participate. Discuss how the result will be used in planning further care or treatments. Perform hand hygiene and observe other appropriate infection prevention procedures. Provide for client privacy. Inquire if the client has any history of the following: muscle pain, onset location, character, associated phenomena, and aggravating and alleviating factors, limitation to movement or inability to perform activities of daily living, previous sport injury, loss of function without pain. Inspect the muscle for size. Compare the muscle on one side of the body, of the arm, thigh, and calf, to the same muscle on the other side. For any discrepancies, measure the muscle with a tape. Inspect the muscle and tendons for contracture. Inspect the muscle for tremors, for example, by having the client hold the arm out in front of the body. Test muscle strength. Sternocleidomastoid. Client turns the head to one side against the resistance of your hand. Repeat with the other side. Trapezius. Client shrugs the shoulder against the resistance of your hand. Deltoid. Client holds arm up and resists while you try to push it down. Bicep. Client fully extends each arm and tries to flex it while you attempt to hold arm in extension. Tricep. Client flicks each arm and then tries to extend it against your attempt to keep arm in flexion. Wrist and finger muscle. Client spread the finger and resist as you attempt to push the finger together. Grip strength. Client grabs your index and middle fingers while you try to pull the finger out. Hip muscles. Client is supine, both legs extended. Client raises one leg at the time while you attempt to hold it down. Hip abduction. Client is supine, both legs extended. Place your hand on the lateral surface of each knee. Client spread the legs apart against your resistance. Hip adduction. Client is in same position as for hip abduction. Place your hands between the knees. Client brings the leg together against your resistance. Hamstring. Client is supine, both knees bend. Client resists while you attempt to straighten the legs. Quadriceps. Client is supine, knee partially extended. Client resists while you attempt to flex the knee. Muscle of the ankles and feet. Client resists while you attempt to dorsiflexion the foot and again resists while you attempt to flex the foot. Inspect the skeleton for structure. Palpate the bones to locate any areas of edema or tenderness. Inspect the joint for swelling. Palpate each joint for tenderness, smoothness of movement, swelling, crepitation, and presence of nodules. Assess joint range of motion. Ask the client to move selected body parts. The amount of joint movement can be measured by a goniometer, a device that measures the angle of a joint in degrees. Document finding in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.